everybody should have access to good quality health care.
True.
Here's 6 points as far as what the new healthcare laws will give to the world.
It's blurry.
Because of the new healthcare laws, before people didn't have access to good quality healthcare. Some people had to wait, or some people were dying. Now, preventative service will be covered at no cost. According to John Alonzo Valvar, research has shown that people tend to skip recommended preventative services if cost is an issue. So if people have to pay for preventative services, they won't go to see what's wrong before they get sick. So that's one thing that the new healthcare law is bringing to pass. Consequently, now services children have prior to insurance companies that were considered pre-existing, they used to count against them, but now according to the new healthcare reform law, pre-existing conditions for children that are 19 and under, pre-existing conditions won't count against them. So that's one thing that the healthcare law is bringing into pass. There was a time when children had pre-existing conditions and insurance companies would deny them coverage based off the fact of it was a pre-existing condition like diabetes, probably major. So now companies can't deny coverage for pre-existing conditions for children that are 19 and under. So that's a good thing that the healthcare reform laws have brought into place. And that's according to Susan J. Children up to 19 cannot be denied coverage for pre-existing. So that's major what the health reform laws are bringing to this country. So that's one of the best reasons as far as healthcare reform. That's major. So some people say that cost is an issue as far as spending $950 billion on healthcare reform. We can tell them that children that are 19 and under won't be denied coverage for anything that's pre-existing. And then, in fact, businesses will be getting tax credits. So if a business allows or starts to offer healthcare insurance to their employees, they'll get tax credits, which is good for businesses, because if you're giving businesses some tax credits, most likely they'll want to hire people more than they did before. Versus now, businesses don't have tax credits. Businesses don't want to hire anybody anymore. So tax credits will be given to small business owners, and according to David Hancock, tax credits up to 35% of the premiums will be made available from the date that they start offering coverage. So 35% tax credit is really good for small businesses, because it opens up a lot for small businesses as far as jobs and things like that. So healthcare reform is bringing tax credits to small businesses so that they can offer health insurance coverage to their employees. A lot of times most small businesses couldn't offer health insurance coverage to their employees because they just couldn't afford it. So healthcare reform is a good thing because it's opening up jobs for small business owners and opening up more opportunities as far as offering health insurance coverage, because a lot of small business owners can't afford health insurance coverage for their employees. Meanwhile, healthcare reform is helping our seniors that fell into the donut hole. Or donut hole. The donut hole is the amount where they reach where a member or an eligible person has to pick up all of their money for their prescriptions. That's what they call the donut hole. So they would get to a point where they would have to pay for all the prescriptions up to a limit, and then that's considered the donut hole. But with healthcare reform, the donut hole by 2020 will be completely eliminated, according to Mike Lillis. So by 2020, senior members won't have to pay for prescriptions at all, which is a good thing, because they're the ones that can't afford it, is seniors. And then furthermore, young adults won't have to go without coverage. Most times, when you're a certain age, when you graduate from college, you don't have health insurance coverage. So now you're supposed to stay underneath your parents' policies until 25. And it doesn't matter if you're eligible to be on your parents' taxes, but you will still be able to have health insurance coverage. So as of the first plan year or beginning of September 23rd, 2010, if an employer-sponsored group health plan, self-funded or insured, cover any dependent children, it must make coverage available until the child turns 25. Whether or not the child can be claimed as a tax benefit is irrelevant to according to Teresa Corona. So it doesn't matter if a child can be claiming your taxes. From now on, a child will be eligible to be underneath your plan until they're 25. And lastly, members can always, when they don't agree with the insurance company, they can go to a third party to appeal. So your appeal right. At this present moment, when you appeal a claim, you are appealing to the health insurance company. So that means that you're going to the person who denied you, which doesn't make sense. So now, with the new health care laws, according to Tim Jones, if the internal review is not satisfactory with an enrollee, the member can appeal to an external body review. So you can go to someone totally outside your insurance company to appeal a determination on your claim versus going to the insurance company, which doesn't make sense at all. So even though healthcare reform is going to cost us billions and billions of dollars, there's 6 points that are good points as far as briefly why healthcare reform is a good thing for us. You'll have preventative services that are covered at absolutely no charge. Pre-existing conditions for children under 19 is covered, which is a blessing. Tax credits for businesses, small businesses, is a blessing. They'll get a nice cut. And then the donut hole. Donut hole